Hi, welcome back. Today we'll be discussing on special senses, which is model 1, and today is study 1, which is talking about the sensation of taste. Alright, so the organs of special senses include the sight, smell, taste, and touch, hearing as well, and balance. For this program, we're going to talk about taste, which is going to be today's special senses, and then the next special senses we're talking about will be smell and then sight, as well as the hearing and balance, which is the vestibulocochlear, which is done by the ear. So we're going to see that will be the last study in this model. So before we proceed into the study proper, the special senses, we have the sense of vision, which is by the eyes, and the organs of taking this information is the receptors, which are called photo because they transmit light information to electrical information that's sent into the brain. And then we have the hearing and balance, which is done by the ear, and this are mechanical because we're going to see the movements of the hair follicles on the tectorial membrane, and the movement is the one that induces the action potential, which sends in the electrical impulses to the right areas in the cortex. And then we're going to talk about the sense of smell, which is also chemical receptors, just like the taste buds. And this is because we need to dissolve the molecules, and then these molecules tend to go and bind to receptors in the different receptors, be it in the taste or olfaction, which is smell. And then this information generates action potential, which tends to send electric information to the brain, and then it's interpreted at the different areas of perception. Then lastly, it's the other sensation, which is touch, vestibular system, and also proprioception. So proprioception is when we tend to move our joints, and that is proprioception. So before we start talking about this the sense of taste, let's see the structure at which contains the taste. So the structure that contains the receptor of taste is located in the oral cavity. And what is the oral cavity? And let's understand the anatomy of the oral cavity. So outside our mouth, we're going to see our cheeks from the exterior. So these cheeks are made on exterior aspect by the skin, and then we have those muscles called the buccinator muscles and the masseter muscles. So we're not interested in that. And then outside, when you open your mouth, but when your teeth are closed, the cavity surrounding your dentic and the dentric system, that is your teeth, that cavity is called the oral vestibule, which is a cavity located between the lips and the cheeks and also the gums. So it is when you open that, then you're going to see the oral cavity proper. So the space between your cheeks and your teeth or your gum is called the oral vestibule. So the boundaries of the vestibule, on the external, we have the lips and the cheeks, and internal boundary is the teeth and the gum. So now we go on the content of the oral or the functions of the oral vestibule is a contentment of food. So when we eat, the foods are not pouring out because of the structures of the vestibule, and also it helps in the distribution of saliva. So right now, if your salivary glands, be it the sublingual or the submandibular gland, produces saliva, when you close your cheeks, it tends to spread the saliva around, and it also helps in our speech. So sometimes when you try to prevent the movements of your cheeks, you're going to feel like making sound. Sometimes you don't have to move your tongue or your teeth, but you can actually produce sounds with your cheeks because you're pushing air into the cheeks, and then cheeks are vibrating and they may create a sound. So clinically, it is important for dental examination, also injection, and also when you tend to have problem with the teeth, when we leave the teenage age, when you lose a teeth, you cannot be able to grow back the teeth. However, this year, a Japanese scientist was able to design a drug that can actually stimulate for the regrowth of teeth, but that is another discussion. So if for now, we rather go for a prosthetics, that is an artificial teeth where you tend to replace the teeth you've lost. Then now we enter the oral cavity proper. This is the large area located internally behind the teeth, all the way to the posterior aspect, which is called the pharynx. So the pharynx is a tube structure that runs from the level of your nose, the level of your throat, or oral cavity, and then below that particular area where we can produce, and also below where we have the larynx. So the larynx are structures that produces our voice, and also we have other laryngeal cartilages, which I don't want you to just get confused with that, but just know that behind our nose and our mouth and our throats, they are all communicating via what is called the pharynx. So the pharynx, we have the part that is located behind the nose, is called nasopharynx, and the part behind, so deep down this image, you're going to see where you see the pinkish structure behind the green coloration, that is the posterior wall of the pharynx. So this is the oropharynx, and below the oral cavity we still have the pharynx around the laryngeal area, that is called the laryngopharynx. So these are three parts of the pharynx. We're going to talk about that later on. However, the major organ that is located in our oral cavity is our tongue. Below our tongue, we have the sublingual and submandibular salivary glands. But for this program, we are not going further to discuss about those things. So this is the image of showing the oral cavity. On the first image on the left hand side is showing the a closed oral cavity, and then you can see the internal structure. So you can see the huge tongue taking most of the space of the oral cavity. Then behind you can see a tube where it is named the pharynx. So you can see that the pharynx above the tongue, so the above the tongue, you're going to see what is called the hard palate. So the hard palate separates the oral cavity and the nasal cavity. So then you can see that we still have a part of the pharynx behind the nasal area, which is called the nasopharynx, as mentioned earlier on. And then they have the oropharynx, and then below that you're going to see the cartilage just below the tongue, that whitish structure. Those are the laryngeal cartilages, and then you also have parts of the pharynx before it continues downwards as either the trachea anteriorly and or the esophagus posteriorly. So the next image is an open oral cavity where you can see the tongue, and hanging behind on the roof is what we call the uvula. In Hausa people call it eruya. That is a uvula, or it is a covering or extension of the soft palate. So then the third image is a magnified view of the uvula, so that you'll be seeing how it continues from the hard palate. It continues down to the soft palate. So it means the soft palate is made of muscles covered with mucous membrane, and then the extension, the suspensory part of the muscle is called the uvula. And then behind the uvula, you can see it looks like a roof that holds on the palatine tonsils. So that roof that makes of the palatine tonsils are actually muscles coming off from the palate as well, and goes into the tongue, some of them, and they are contributed to the muscular contribution of the tongue, which we're going to talk about it later on. So the boundaries of the oral cavity, anteriorly and laterally, we have the alveolar processes, which are the gum and the teeth, and then superiorly we've seen the hard palate and the soft palate, as well as the uvula and the posterior aspects. And then you have on the inferior aspect, you have the muscular tongue, and below the muscular tongue we have what is called by the mylohyoid muscles, and we're going to see this mylohyoid is coming coming from the inner wall of the mandible, going to attach onto the hyoid bone. So the hyoid is a very tiny bone just at the base of our head, and the junction where our head continues with our neck, that is where we have the tiny bone known as the hyoid bone. So the muscles leaving the mandible and inserting to the hyoid bone, that is what we call the mylohyoid. You're going to see how the names of the muscles are associated with this point of origin and insertion. Then another muscle just above that is what we have the anterior belly of digastric. So the posterior belly of digastric is not associated with oral cavity, but rather the neck area, which we're not going to talk about it. Then you have the glenoid muscles, and the glenoid muscles are also coming from the mandible, from the mandible, and also going to insert onto the hyoid bone. So the tongue and its reflections, that is the structure, what you touch on your tongue are not actually taste buds, but rather they are papillae, and those papillae are folding of what we call the mucous membrane. So all those roughness on your tongue are not the taste buds, but rather we have what is called the fold of the mucous membrane, which is called the papillae. So on these papillae are what we're going to see later on, the tiny taste buds, but that is going to be in the next few slides. Then the posterior wall of the oral cavity is made by the oropharyngeal isthmus, that is the opening that leads into the oropharyngeal area, and then you can also see in the superior aspect, you get to see the soft palate, and then you see the muscles that was holding on to that tonsils, which we talked about, is called the palatoglossals. So it means it's coming from the palate and inserting into the tongue. That is why it is called the palatoglossals, and it forms like an arch structure, and that is why it's called the palatoglossal arch. So the arch itself contains the muscles, just like in this third image where you see the curved structure beside the uvula. We see something curved like a pillar holding onto the palatine tonsil, and that is the structure holding that is the palatoglossal arch. So now let's talk about the functions of the oral cavity. The oral cavity is important for the digestion because digestion starts there. It be fluid or liquid because we already have the saliva, which contains several enzymes that start to break down the food. And then we also do, because we have the mechanical friction between maybe the tongue and this hard palate, also the teeth and the tongue and the teeth and the buccinator, all the structures there, they contribute in what the chewing, and so chewing we call it the mastication. So like earlier on said, we said the saliva contains enzymes that helps us in breaking down this food, and it is very important to break down the food because we need this food to be broken down into smaller chemical molecules that can actually bind onto the receptors of the taste buds, which you're going to see later on. So so another thing is that the tongue serves the oral cavity, not just the tongue but also the structures. We have taste buds found also on the epiglottis. So the epiglottis is structure behind the tongue, behind the oral cavity, that when we are eating closes the trachea, and when we are swallowing it also closes the trachea. But when we are talking and breathing, what happens is that the esophagus is closed and then enough air is passed into our lungs via the trachea, and that is why epiglottis is very important. So on the dorsum aspect of the epiglottis, we also have the taste buds as well, and then we also have the tongue, also the buccinator muscles, the cheek muscles, and everything also assists in swallowing. We also produce sound because of the modification of air in our oral cavity, be it in our laryngeal area And also the oral cavity is important because it is important for respiration, and also it limits digestion, and also finally it is important for sensory perception. So sensory is not just the special sensory. So special sensory in this case is taste, but other sensory perception is when we put something hot in our tongue, we know that we put something hot in our tongue. So this is normal sensory perception. As well, even if we close your eyes, we put something, we'll be able to identify what type or predict what structure is in our mouth, because of our tongue is able to feel the texture and will be able to identify it. And then if we bite our tongue or we mistakenly bite our tongue, or something happens to our tongue, we're able to feel it because we know it's pain. So these are different types of sensory perception: detection of temperature, detection of texture, detection of pain. Another type of sensory perception is that special sensory, which is the taste. So now let's understand the anatomy of these particular structures. So it is important to see how, so you can see that we have the nasopharynx. So you can see the nasopharynx is a part of the pharynx that is associated with the posterior aspects of the nasal cavity, and then you can see it labeled as nasopharynx in blue. And then the oropharynx starts below this uvula. This is the hanging part of the soft palate, and it's very short, and that is why you see it there. So it extends from below the uvula and the tip of the epiglottis. So that epiglottis is that structure that helps us close on the trachea. When we are eating, trachea is located anteriorly, and then also when we are talking, it closes the esophagus, and this is important to help to prevent choking. And sometimes when this epiglottis is missed, it misses its job. That is why we choke when we are talking. Okay. So, and we said that another thing is that this nasopharynx allows the interaction of our smell and also taste, and that is why sometimes when we perceive the smell of something, we feel like if it has a nice smell, automatically it gives us this sweet taste. So there's this fruit in Malaysia and Singapore. It's called durian. It's their national fruit. Durian normally has a very like an ice cream texture, and if your nose is blocked, you've never smelled it, it is sweet. However, when you smell durian and then taste durian at the same time, because the smell is like toilet, so it is banned internationally on flight. So the smell of durian makes it very uncomfortable for people that are not origins of maybe Malaysians or Singaporean. But the smell is horrible, but the taste is like like ice cream. So the interaction of the nasopharynx, the molecules are going to bind to give us the sensation of smell, intensify the sensation of taste. All right. So this also this intensification could be both chemically activated, and what happened is that because we're going to see around the nasal area we have the nasal sinuses. These are cavities on our face, and they helps to make our face lighter. And these nasal cavities, when we are sick, it produces mucus. That is why when you have flu or when you cry, you feel like there is water dropping behind your neck, and this is because of the increase in the secretion or production of mucus or fluid inside the nasal cavities, and a lot of them drain via the oral the pharynx, and that is why when they move from the oropharynx, we also feel them inside our from the nasopharynx, we feel them around our oropharynx before they gradually descend and go to the stomach via the esophagus. And so sometimes if the mucus concentration is high, that is when it dilutes the food in our mouth, and then we don't perceive the taste of that food enough. Sometimes when we have infection, it means that these mucus are coming into our oral cavity and also in tampering, or because they bring the infection into our oral cavities, and then our taste buds, which are also called the gustatory cells, will going to be inflamed and they will not be able to function properly, giving us the right smell. All right, so these are some of the things that also affect the sense of taste, the interaction between taste and smell. So when you see the nasal drip here, the nasal drip means that gradual flow of mucus from the nasal cavity and also nasal sinuses. And sometimes if we cry a lot, because our tears also drains into our nasal area, that is why you see our nose will be running when we are crying, and also you feel like fluid or water drop going behind your oral cavity. All these are called the nasal drip. So now, the anatomy of tongue and sensation of tastes. So the tongue is a massive muscular structure seen in the oral cavity, pinkish in structure, very rough on the dorsum. But when you try to put your tongue at the tip, you feel that the ventral surface is very smooth. So the surface below your tongue is the ventral surface, while the surface that is rough, that is on top, is called the dorsal surface. Okay. It contains several numerous projections, which are called the papillae, and as well we have several glands that are also found around the tongue. Some of them are the salivary glands, which we have the submandibular and sublingual, and then behind, just in front of our face, we have the parotid gland, which drains also into our oral cavity. And then so the functions is it facilitates the perception of gustatory stimuli, so it means it's important for special senses of taste, and also helps in mastication, identifying of texture, and also assist in the production of sound. That is what the voice we talk. The structures within the oral cavity, we said we have the tongue, all right, we have the teeth, we have the palate, both soft and hard palate, and the uvula suspended. We have the gingiva, which is the gum, we have the salivary glands, and then you remember we have the oral mucosa. The oral mucosa is the membrane that folds over, and then they are made of stratified squamous epithelial tissues, and they're different in nature of how they are folded, produce this rough texture on the dorsum of our tongue, which are called the papillae. And deep inside the papillae is where we find the cells that are called the gustatory or the taste cells. So here, tongue varies in length and also in size. We have three parts. We have the apex, which is the tip of our tongue, and then we have the body, which is the major part of our tongue, and then we have the root. The root is from where we saw that the palatine tonsils all the way to the epiglottis in the posterior aspect of it. So we can see that the body also is subdivided into the rough dorsum, just like we said earlier on, and the smooth ventral surface is where we said if you put your tongue at the tip or top of your palate, the soft area is the ventral surface. So here we can see that we have different muscles that makes up the tongue. We have what is called the intrinsic muscles, and also we have what is called the extrinsic muscles. Sorry for the overlap here. So the intrinsic muscles are muscles that originate and insert within the tongue. They start and finish all within the tongue, while the extrinsic muscles are muscles that come from exterior aspect to insert into the tongue. So you can see here we have what is called the transverse muscles, and also we have what is called the vertical muscles. These muscles are originating and finishing, they start and end inside the tongue. However, when you see that in these, you have the muscles on the inferior aspect where they fan in and go into the tongue, this is where you have the where you have the genioglossus muscles. So those are more extrinsic muscles coming from the outside, which we're going to see them later on. But let's talk about the intrinsic muscles, which starts and completes inside the tongue. So the before we go on, I want you to understand that the prefix glossus, and anything you see prefix glossus or suffix gloss or suffix glossus, stands for tongue. All right, so whenever you see glossus, it automatically tells you it's associated with the tongue. So you have the intrinsic muscles originates and terminates in the tongue. Their name according to the direction that the fibers move. The muscles change. The main function of this kind of muscles is to change the shape and size of the tongue. The shape and size of the tongue. That's their main function, and support the action of the extrinsic muscles. And also all the muscles, all these intrinsic muscles are innervated by hypoglossal nerve. So hypoglossal nerve means below the glossals, below the glossals. So hypoglossal nerve, which is the cranial nerve 12, is the one innervating this. These are plain motor nerves innervating this. So intrinsic muscles, we have 4 intrinsic muscles. We have the superior longitudinal lingual muscles. So you can see where you see the fibers going there. Those are the superior longitudinal lingual muscles. And then anytime you see a superior, you're going to see an inferior. However, in this image, inferior is not obvious because it's located below that fan looking muscles, which is called which is a part of an extrinsic muscle. However, you can see the direction of the transverse muscle. So their transverse lingual muscle coming upwards, and then you can also see the vertical. So the vertical, the transverse is going right to left, while the vertical is the one going up and down. So transverse is not very obvious in the image below. However, when you check the image above, you're going to see them as round looking muscles. This is because they move from right to left, and on horizontal transverse section like this, they look long and they look round, while the vertical muscles, you can see them going up and down. So the extrinsic muscles, also in this image, you can see how the transverse muscles are moving from right to left, and you can also get to appreciate the vertical muscles going up and down, and then you could also get to appreciate the superior longitudinal as well as the inferior longitudinal in this aspect. Okay, so this is another image for you, so you can pause and look at this image so that you could appreciate the superior longitudinal and inferior longitudinal in this image, as well as so this palatoglossus, styloglossus, hyloglossus, as well as genioglossus, which is that fan looking muscle, are all extrinsic muscles, and so you can see there are 4 in number as well. So the intrinsic muscles, like we said earlier on, are 4 in number. So superior and inferior longitudinal lingual muscles, you have transverse lingual muscles and the vertical lingual muscles, and we said their function is mainly to change the shape the shape of the tongue. So here you can see another image that shows you the intrinsic muscles, which are located more on the right hand side, and then the ones on the left hand side are the position of the extrinsic muscles, which we'll start discussing in the next slide. So here the functions of the intrinsic muscles, it shortens and widens as well as coil up. So you can see it changes the shape and size, so shortens, widens and coil up. And then so that is superior longitudinal and inferior longitudinal. They do the same functions. However, the transverse muscle, which move right to left, you know it's going to change the shape of it during chewing and also during swallowing. So it narrows and deepens, so just like if you like to curve your tongue inside your mouth. And also it helps the extrinsic muscles to elongate and protrude the tongue. And so the last one, which is the vertical muscles, it's helps in also flattening and widening and elongating the tongue. And now we talk about the extrinsic muscles. We said the extrinsic muscles are also 4 in number, and the name goes as the points of origin, and all of them insert into the tongue, and that is why you can see they have a suffix that is called the glossus. So these muscles, we said there are 4, originate from the outside, and muscles and helps in the movement of the tongue, and they have motor innervation by the hypoglossal nerve. Just like the intrinsic muscles, the hypoglossal nerve also innervates all these muscles except one which is the palatoglossus, coming from the roof of the tongue, because we're going to remember the roof of the tongue and the posterior aspect of the tongue, that is the epiglottis, that is the root, are innervated by the vagus nerve. So everything is innervated by hypoglossal nerve, that is motor innervation, except the glossopharyngeal nerve, glossopharyngeal muscle, which is innervated by the vagus nerve. The vagus nerve is the cranial nerve 10. So here we're going to see them based on the name of the muscles, their origin and insertion. And it's not going to be surprising that we say the genioglossus muscle. It's from the symphysis of the mandible, so you can see it's there. It's fanning upwards, and you can see some of the fibers going up into the tongue, while you can see some of the fibers and the lower aspect going into the hyoid bone. You remember we said the hyoid bone is a very small bone found at the junction of the head and neck. So that is the hyoid bone. So hyoid bone is important because it helps us in swallowing, in chewing, and also movement of our laryngeal structures. So with genioglossus is important because it helps in the lengthening of the entire length of the tongue. So it inserts entirely at the tongue, so it has an important function in elongating and protrusion of the tongue. And then we have the hypoglossus. So the hyoglossus. The hyoglossus are muscles coming from the hyoid and inserting into the tongue. They are mostly inserting at the lateral part of the tongue. So you can see the hyoglossus coming up and inserting at the lateral side, while genioglossus mostly found in the midline, insert in the midline of the tongue. And so next we have the styloglossus. So styloglossus is the one coming from the posterior bone there, and it comes ventrally and insert on the also medial and lateral aspect of the tongue, so mostly the side of the tongue, and this is coming from the styloid process. So you can see it on the posterior aspect, as posterior superior aspect. It's called the styloglossus. It's coming from the styloid process and inserting onto the side of the tongue, more of it. And then lastly we have the palatoglossus. So the palatoglossus is important because it comes from the soft palate. So you can see it up there. It's coming from the soft palate, and it goes mostly at the midline and also the lateral aspects to insert into the tongue. And like we said, everything, all motor structures, all the muscles in the tongue are innervated by hypoglossal nerve, which is the 12th cranial nerve, except the palatoglossus, which is coming from the palate, is innervated by the vagus nerve, which is the 10th cranial nerve. So this is an image with colors to help you see where these muscles are coming from and how they insert. So you can see the genioglossus is a blue muscles, and it's inserting mostly on the midline, more broadly throughout the entire length of the tongue. And then you can see next we have the hyoglossus in green, coming from the hyoid bone, and it will go and insert onto the lateral sides, and few fibers go into the midline. And then the purple muscle coming from and the superior aspect, they are coming from the styloid process. So it comes in and insert also on the lateral aspect of the tongue. In this image, however, we don't see the palatoglossus, which is coming from the palate and also inserting on the lateral aspect, but also in the midline aspect of the tongue. And like we said, everything are innervated by hypoglossal except the palatoglossal, which is innervated by the vagus nerve. So the functions of this is that genoglossus helps in protrusion, protruding the tongue. And then we have the hypoglossus, which helps in the depression and retraction of the tongue. It means it pull it backwards and also depress it because it is coming from the hyoid, which is in the lower aspect. So when you try to pull it lower and back behind, that is what it does. However, stylo process also pulls it behind but upwards. So you can see the stylo process is just like pulling the tongue behind and upwards. That's what it does. Palatoglossus helps to elevate the back of the tongue, and especially when we want to swallow, and also lowers the back roof of the mouth, that is the uvula. So this is an image that we showed earlier on. You can pause and study this image. This is a fascinating image showing not just the muscles of the oral cavity, but also the buccinator, that is the cheek muscle, and you can see it's very clearly shown. So next we're going to talk about the motor innervation, the anterior aspect. So on the left hand side, you can see that all muscles are innervated by hypoglossus nerve except the palatoglossus, which is innervated by vagus nerve. And also so all the muscles are coming from the anterior aspect are all coming for innervated by hypoglossus. However, you can see the palatoglossus nerve is coming from the posterior aspect and is innervated by the vagus nerve. So when you go to the right hand side, these are sensory innervation. Don't forget that sensory, we have different types of sensory. We have the temperature, touch, and pain, and then we have the spatial sensory. So all the other ones, we are going to put them together, that is temperature, pain, and touch. We're putting them as one. However, spatial sensories is one we're going to be doing it differently. So there's the lingual nerve, which is a branch of the trigeminal nerve. That is the third branch of the trigeminal nerve. So trigeminal nerve have 3 branches. Trigeminal nerve is the 5th cranial nerve coming from the pons. So the first part of it is ophthalmic, which goes to innervate the structures of the eye. And then you have the maxillary branches. So the maxillary branches are involved with innervation around the cheek area and the below the eye and nose area. And then the last branch is the mandibular branch, which is a branch that innervates structures around the mandible, that is the lower jaw. So this is the classification of the trigeminal nerve. That is why it's called three roots, that is what trigeminal means. And then so we have a branch of the mandibular division of trigeminal nerve is called the lingual nerve. So the lingual nerve is the one that does general sensation, that is the temperature, touch, and pain. However, special senses, that is the one involved with the taste buds, it is done by the quadra tympani nerve. And the quadra tympani nerve is the 7th cranial nerve. However, it takes a ride with the lingual nerve. So some of the branches from the 7th cranial nerve enters and goes along with the lingual nerve. That is why it is able to get to the tongue. So the special senses, that is the sense of taste, here is by the lingual nerve. So when we come onto the posterior part of the tongue, so you can see we have posterior 1/3, and don't forget we said that we have taste buds also located in the posterior aspect of the tongue, especially on the epiglottis. So it means that the epiglottis, the senses, the special senses that are found around the epiglottis, are also done by glossopharyngeal nerve. So glossopharyngeal nerve is the ninth cranial nerve. So you can see it glosso and pharyngeal. So it means it is involved with the tongue as well as the pharynx. That is why it is called the glossopharyngeal nerve. It does both general senses and also special senses. So that is the sense of taste of parts of the tongue and the root, that is the back of the tongue containing the epiglottis as well. And also you have also antennal laryngeal nerve, which is a branch of the vagus nerve as well. So here you can see that general senses for that is by the lingual nerve, which is the branch of the third branch of the trigeminal nerve. And then you also see the glossopharyngeal nerve also does general senses. And when we come to special senses, we can see the quarter tympani is doing the anterior two-third, while posterior glossopharyngeal nerve is also taking posterior one-third, and also you have some parts of the roots is also by the internal laryngeal nerve, which is a branch of the vagus nerve. So this tongue is also innervated by a vasculature or blood supply. It is supplied by the lingual artery, which is a branch of the external carotid artery, and also you have smaller branches coming from tonsillar artery. So tonsillar artery is a branch of the facial artery. So the venous drainage, that is the drain how the veins, the blood had been drained away from the face, is by the lingual vein that drains into the internal jugular vein. So now we go into the organ of taste. You can pause and rest, or you can continue. So before we move on, we want to ask a question: are papillae the same thing as taste buds? As we mentioned earlier on, papillae are they are the rough texture structure found on the dorsum of the tongue, where you can actually feel it. Those rough patterns, you can put your hand, sometimes it looks whitish. So these are papillae. However, the taste buds are tiny structures located on the papillae, and we said the papillae are squamous epithelial. We have stratified squamous, so several layers of smooth cells. That is what makes up the papillae, and we see them drawn into folds, and these folds are important because these folds are the ones that makes up the papillae. So the folds are the structure that makes up the fold is called the mucosa or the mucosa epithelium. All right, so next here is we said the dorsum of the tongue is the one that is very rough, and then we also have we say they are lined with mucosa. This mucosa, the folding of this mucosa forms this projection known as the lingual papillae, and these types of folds have been categorized into four. From anterior, we have the fungiform. The fungiform is because it looks like a mushroom shape, and then we have the tiny ones, the ones that are narrowly projected, that makes up the majority part of the papillae in the ventral aspect of the tongue. When you go to the mirror and look at the tongue, the ones that look narrow and whitish all over your tongue, they are called the filiform. And then on the lateral aspect of your tongue, sometimes you see them like ridges of farm. Those are called the foliate. And last, we have what is called the circumvallate papilla. The circumvallate papilla are the ones on the posterior aspect, and they are important because they are very large, and they are important for the taste of bitterness. That is why when you swallow medicine or something you feel like the bitterness is very intensified around the back of your oral cavity. So we're going to see individual each of these papillae before we go to see where these taste buds are located. So here we can see the different types of the papillae, and we said from the most anterior aspect we have what is the fungiform, which we said looks like a mushroom shape, and then next one we said we have the filiform. So the filiform, like we said, it makes up the majority of the whitish structure on the tongue. However, one thing that differentiates the filiform from the other one is that the filiform does not have a taste buds on it. They do not have a taste buds on it, so you do not have special senses on the filiform. However, all the other ones, that is the fungiform, the foliates, and also the circumvallate papillae, they all have, or sometimes you just see the vallate papillae. So either the circumvallate or the vallate papillae, they are the same thing. They all of them have the taste buds on them. So here is a magnified view of that particular structure. So you can see these are all epithelial tissues. However, if you notice, there is an arrow showing us taste buds. You can see taste buds is indicated in all the other ones except the filiform. It does not have a papillae. All right, so here there are different how we explained this particular individual papillae. So when we talk about the fungiform, which is the first one, you can see it's a pear shaped, a round shape like mushroom, located at the tip, mostly at the tip and lateral sides of the tongue, and contains a moderate number of taste buds, mostly at the upper surface. So here you can see where the expansions of the taste buds are looking in the big images. So this is the first one. Then we go to the filiform. So the filiform, you can see it looks like an inverted U. It does not have a taste buds in it. It is scattered, mostly scattered along the dorsum of our tongue, looking whitish, very numerous, has no taste buds, and it is involved with the texture, sensation, and chewing. So it helps in increasing the friction between the food and the tongue. And you can see that apart from the tongue, you can also see the smaller papillae found everywhere at the cheeks and also at the epigluteal areas. So next we have the foliates. So the foliates are found at the lateral aspect, but we lost majority of our foliates after the age of 5, and that is why if you try to bring out your tongue on the lateral aspect of your tongue, you get to see some ridges looking like structures. Those are what is referred to as the foliate structures. So here we get to see the last one, which is called the circumvallate papillae, or the vallate papillae. It is located mostly on the anterior aspect of the sulcus terminalis, that is the part that separates the anterior 2/3 of the tongue and the posterior 1/3. We have about 8 to 22 of them, and making a curved structure at the back of our tongue, and they're very large in size, and they're surrounded by a groove, and that is why they are called the circumvallate papillae. And it contains the majority of the taste buds, about 10 to 300 per papillae on each of the about 300 papillae taste buds found on each of the papillae. So here is a histological image of the tongue, and then you can see a magnified view of the papillae, and this is mostly the foliate papillae because of the ridges looking structure. And when you look at there, we said that these are stratified squamous epithelial, which are mucosas, and then you can see the spaces between the fold are called the furrow, and when you magnify that, you get to see the taste buds on the lateral aspect of that. And so, like we said, the taste buds, we have about 3,000 to 10,000 in adults, and more are found in children. And as we age, by the time we hit 45, we drastically lost majority of our taste buds, and that is why we say that old people like daddy, is because they've lost their sensation of taste, and when they cook, they tend to put more sugar or more salt in their food. So mostly they are on the tongue, but also found on other parts like the soft palate, epiglottis, the tonsil pillar, that muscle, the folds covering the palatoglossal muscle, and then we have them on the proximal esophagus as well. That is why sometimes if you swallow food, you tend to also feel the bitterness or the taste when you swallow food, and also in the pharynx. So this is a magnified view of the tongue, and you can see the papillae. When we try to enlarge that particular area, you can see that we have the fungiform, and then we have a lot of the filiform papillae, which are the projected ones. And when we magnify one of these, you get to see this, the four, and also what we tend to believe those are the test buds. These microscopic structures that looks like pear or onions or albasa, they are the test buds. So when we magnify them, this is what we get to see. So this is now the test buds we are all after, and we said we find them on all the papillae except the filiform. Those are the projected, the narrow ones. So what are the test buds? So the test buds are made of collections of cells that looks like a bulb in structure and supported by the squamous epithelium, like we can see on the lateral aspects of the yellowish structure. So now the two colors of purple are important because the other purple, the pinkish purple, is actually the receptor cells, or what we call the gastatory cells or the receptor cells, because at the bottom you can see what we said, the taste afferents. So these are nerve fibers that are going to the brain. So the ones at the bottom of the receptor cells, they have those fibers that send action potentials to the brain, and beside them you have what is called the supporting cells. So these supporting cells are important because they provide support to the cells. And also, not shown in this image, we have what is called the stem cells. So the stem cells are cells that can differentiate to give rise to either the receptor cells or the supporting cells. So for instance, if you bone our tongue, minimum boning, not a maximum boning of our tongue, what will happen is that we feel the sensation or bond, or we cannot feel the taste. But however, in 3 days time, what happened? We don't feel that. What happened is that the cells, the receptor cells that were burnt with the tea or whatever burnt our tongue, will have degenerated, and those stem cells in the gustatory bulb, they will transform themselves to give rise to those receptors or gustatory cells, and then our taste is resumed. However, if you have a very intensified burning, you might completely permanently lose the sense of taste because those taste buds might not grow. So here you can see on the superior we have what is called the microvilli. So these microvilli or cilia are important because that is where, when those molecules, the chemical, the food molecules, were broken down, gets to bind, and when they bind there, what they do is generate action potential, and those action potential are sent to the efferent or taste efferent fibers, and like an electrical impulses. Those electrical impulses are then sent to the brain. So next let's see these are all test buds, and then we can see them in this illustration. We can actually see the test receptor cells, which have the afferent nerve fibers, and then you also have to see the basal cells. Those basal cells are actually the stem cells, and then you can also see the supporting cells there. So they are very important because, like we said, the test paw has where we have the cilia, and then the chemical receptor, the chemical molecules bind to those cilia at the taste paw and activate an action potential. So this action potential sends electrical impulses via the efferent fibers to go to the brain. Okay, so like we said, the test buds look like berry shaped and contains 50 to 150 long spindle shaped cells, and we have 3 types of cells. We have the gustatory or the test, or we have the basal, which are the stem cells, and we have the supporting cells. And don't forget that we have the efferent and nerve fibers. Afferent nerve fibers. It means fibers taking information from the exterior and going to the brain, and this one is called the first order because it's the first one that comes up directly from the action potential, and it is called the first order neuron. Later on, we're going to see the second order and third order neurons as well. So the gustatory test cells